It's Dr. Seth Gamrad from USC on harvesting and preparing a bone patellar tendon bone autograft for ACL reconstruction. First, we're going to put up the tourniquet. We're going to get some incisional mobility. We'll cut the peritoneum, harvest the tendon with a 10 or 11 millimeter double scalpel, and then harvest tibial bone plug in a trapezoidal shape and a patellar bone plug in a triangular shape. We'll first start out with a incision just medial to the center of the patellar tendon. Don't need any incision more proximal than the inferior pole of the patella. We'll come down through the subcutaneous tissue, taking care to make our knife more shallow than the peritoneum. Here we're going down through the subcutaneous tissue. There's always some bursa there as well. You can detect the peritoneum because it's going to have transverse fibers, whereas the patellar tendon is going to have longitudinal fibers. So here's that incisional mobility we're talking about. I like to have 1.5 centimeters of mobile skin. It allows your incision to be a little bit more mobile, and it allows your portal sites to be made inside the incision if you'd like. So here we're cutting the peritoneum. We're cutting that transverse tissue, both proximally and distally, to expose the patellar tendon itself. Once we've incised it, I like to use a Metzenbaum scissors to dissect both medially and laterally to see the full width of the patellar tendon. Just carrying that dissection here laterally, and then we'll take it medially as well. I like to deepen the Wheatlander retractor and place a Army-Navy retractor proximally to expose the full width of the tendon. Once that tendon is exposed, we like to do this part on flexion, so there's tension on the patellar tendon as you cut it. So I've marked the center of the patellar tendon with a marker, and this is a double 10 millimeter scalpel, commercially available, and we just use the belly of these blades to cut the tendon alone. If you go down onto bone, either proximally or distally, it tends to pinch the blades together and narrow your graft. So you can see we're just doing a little bit with that. Next, we take a 15 blade and we're going to finish that cut down distally onto the proximal tibia, squaring off a 25 by 10 millimeter bone plug. Once we've got that bone plug marked out, then we're going to go ahead and expose it, and then take a 1 centimeter sagittal saw, go down medially and laterally with the object of creating a trapezoidal bone plug. And the depth of this is probably about 15 millimeters. We like to take a little bit of extra bone off the tibia so we can bone graft the patella at the end. So there we're making our transverse cut straight down onto the tibial tubercle, again about a depth of 12 to 15 millimeters. Then I take a 1/4 inch osteotome, I place it right at the insertion of the patellar tendon on the proximal tibia and tap that in, and that'll usually free up our bone plug right away. So now the retraction of the patella is very important because this is a little bit more technical of a saw cut. So you can see our nice wide tendon graft there. We're having an assistant pull distally on the tendon and then hold one of the sen retractors. And then my scrub tech will usually hold the other sen retractor while I do this part. And again, we're going to square off a 10 millimeter, and this time instead of 25 millimeters, I'll usually do about 20 millimeter bone plug coming off the patella. And we're going to use that same saw, this time a little steeper angle with the goal of creating a triangular bone plug. You can see that saw cut is a little bit steeper, trying to meet a centimeter or so deep without going down through the articular cartilage of the patella, which would be a big mistake. So once we've got those saw cuts made, I like to make a triangular cut, not too deep on the proximal aspect of my bone plug. And then again, I use that 1/4 inch osteotome to free up the bone plug. Gentle taps on the patella, and you can see it pops right out because we've done a nice triangular bone cut. And make sure the graft does not hit the deck here. Got real good hold of it. Trim off that little bit of fat pad, and then here's our graft. What we look for when we're judging this is that the bone plugs match up, meaning the same fibers of patellar tendon are harvested on each end of the graft. And you can see we did a pretty good job there. So we'll switch gears here and do preparation. We're going to clean the tendon, shape the bone plugs with a raw endurance saw. We're going to measure the tendon length. I use N+5 for the angle of the tibial guide. We'll drill holes and pass sutures through the graft and then put that graft on tension. So here I'm measuring the graft, and you can see 25, end length of 45, and then 21 for the patellar/femoral bone plug. We got to make sure those pass through a 10 millimeter tunnel. It's better to undersize this. You're going to be fixing with powerful interference screw fixation, so you're better off undersizing those bone plugs so that graft passage is easy. Once we've drilled some holes, then we're going to pass sutures. I like to use fiber loops from Arthrex. They're preloaded with Keith needles, so they're really easy to pass through. And we just snip them and snug them up so they're 50-50 on either side of the bone plug. Once we've finished passing those sutures, I like to use 3 on the tibial bone plug, 2 on the femoral bone plug. Then we'll clamp that on 15 newtons of force, and then mark the patellar bone plug, and that's our completed graft.